Last week, marchers stormed Washington, D.C. to assail the Affordable Care Act, also known as Obamacare, on the eve of its second anniversary. Decrying the president's health reform referendum as an audacious example of big government, they called on the Supreme Court to roll back health care reform signed into law in March 2010. Here's a different perspective. Healthcare packaged up and delivered by private enterprise, big business, and physician groups in the United States has failed by many measures to deliver on the promise of world-class care. Healthcare in the U.S. is the most expensive on the planet, but ranks well below New Zealand, Canada, the U.K., Germany, and France in promoting healthy lives. For-profit hospitals treat and treat patients who have no health insurance, so the 50 million Americans who lack health insurance are denied access to affordable, quality care. Health insurance companies exclude coverage for pre-existing conditions. In the U.S., if you get sick, you go bankrupt. Health is a human necessity. It is a human right, and it is the foundation for everything we do, for everything we hope to do. How can we pursue life, liberty, and happiness without it? I agree with the marchers. President Obama's health care reform law does represent government intervention. But unlike the bailouts of General Motors, Bear Stearns, and Fannie Mae, the Patient Protection and Affordable Care Act seeks to rescue all of us from the flaws and spiraling costs of an imperfect system. As to the naysayers who denounce the law's requirement for all individuals to purchase health insurance, I say this. As everyone is required to pay taxes for public safety and police and fire protection, interstate highways, public schools, and a first-rate military, so should everyone share in the cost of universal health care for all our citizens. For questions or comments, email me, Dr. Jim at drjimshealthline.com. Then be healthy, be happy, and I'll see you next time on Healthline Today.
Opinions on this station and the web of Dr. Jim Linhart are educational and informational and are not a diagnosis, treatment, or substitute for professional medical advice. Consult a physician or healthcare professional for your health or medical needs.